Well, hey there. We're here to talk about perimenopause and how osteopathy can help. So, osteopathic or an osteopath does manual therapy in that they will pick up your body and hold you and move you around a little bit to help you with body pain. But it's not like a chiropractor because there's no cracking or popping, or physio because it's not necessarily like something you're going to do with an exercise at home where you're strengthening or moving something. It's more like practicing the body to come back to a neutral posture. You could think of it like, so you're not in that defensive posture, you're not asleep, but you're just in a neutral posture. And I have found it to be remarkably helpful for my symptoms in perimenopause. So I asked Mac if he would come and talk to us today about what exactly is this mystery osteopath and how it does help with balancing hormones. So take it away, Mac.
Absolutely. Thanks so much. So, welcome. Thanks for taking your time this evening to come and hear about how osteopathy can help with peri and menopause. And probably moving forward, I will just refer to it as menopause. And just know that it's inclusive in perimenopause itself and the time afterwards. So, I'm Mack Gregoraschuk. I am a manual osteopathic practitioner here in Calgary, Alberta. And I operate under the name of Access Osteopathy. And I'm really privileged to be able to work out of three lovely clinics here in Calgary. And I found my way to osteopathy in a little bit of a curvy line. I completed my kinesiology degree at the University of British Columbia. And I had thought I would go into physiotherapy. So I spent a little bit of time working as a clinical kin. Through that time, I wasn't super sure if the clinical life was really what I wanted. So I transitioned into the fitness industry, and I was spending some time in the fitness industry working, and it was good. I still wasn't feeling super fulfilled, but I had some old nagging injuries come up, and I decided I needed to deal with it. And like I hear often from a lot of my patients, nothing was really helping. I tried everything. Nothing was really helping. Nothing was sustaining long-term change. I still had back issues. I still had shoulder issues. I still had stuff going on in my digestive system. And I would say osteopathy sort of found me. My physio at the time was in school to also become an osteopathic therapist. And she said, you know what, Mac, let's just try this out. Let's give this a go. I had no idea what it was. I hadn't heard of it before. I had no idea. And so she worked with me, and I finally had sustainable change. It got me really interested. Light bulb kind of went off. This is what was missing. This is why I didn't go back to school for physiotherapy. This is where I was meant to go. And so that's sort of the process of how I found osteopathy. I think that also right now is a good time to acknowledge that I am the only man speaking in this conference, and I feel very privileged. And thank you, Jessica, for bringing me on. And I think I might be the only man to speak in any of the conferences thus far, but I think it's really, really important. I think that when I really think about it, the most important people in my life are women, and they are either going to go through menopause, are going through it right now, or have already gone through it and walked that path. And really, times are changing, and menopause is taking a big, large step into the limelight. And we are acknowledging the impacts of it. And really, it impacts all of us. And I truly believe it's very important that your practitioner, especially your male practitioners, are on board and hearing you for what your symptoms are, what's going on in your life, and how can we help to restore quality of life and get things moving forward. So with that, um, I'm just going to go through a quick disclaimer here. All of the information we're going to talk about today is for educational purposes only. It's not intended to diagnose, treat, cure, or prevent any disease. The material that we're going to be going over is going to reflect general osteopathic principles. It is not a substitute for individualized clinical judgment. Treatment approaches should always be adapted to the specific needs and medical history of each patient. General questions today are very welcome. Please feel free, put it in the chat. If you have anything more specific or sensitive that you'd like to address, please feel free to contact me directly. You can either send me an email or you can send Jessica an email and she can forward it on my way. I think the other thing I really want to address right here is that in Canada, the terminology that we use for the title of manual osteopathic practitioner is a little bit different province by province. Okay, so you may have heard the term osteopath or something along those lines. Now, that is considered a doctor of osteopathy. So they are trained in the US and they are medical doctors and they provide medical diagnosis. Now, every province is a little bit different. Here in Alberta, I can refer to myself as a manual osteopathic practitioner or a manual osteopathic therapist. We are providing the manual side of osteopathy as it was founded by the founder, and that's just a little disclaimer. So everywhere's a little different. Make sure you look into that when you're looking in your province specifically. So quick agenda. What are we going to go over? What can you expect? We're going to go over what is osteopathy, what a treatment process looks like if you were to come to see myself, the cycle of health, hormonal changes in menopause, common symptoms I'm seeing in my patients. We're going to talk about the autonomic nervous system and fluid dynamics, which I think are the two most impactful ways that osteopathy really works to help alleviate some of the symptoms that my patients are experiencing. I'm going to go through a clinical case study, and then there'll be time at the end for any questions that you have. So, what is osteopathy? Well, it is a manual therapy. It's a very gentle form of manual therapy. Okay, so it's very similar to other modalities such as physio, chiro, massage, in the sense that I'll be moving your body around. Everything after that is a little bit different. So the first way is how we're able to work gently with the body. So everything in our body is working on reflex loops. Our body has to sense something. There's either you feel something, touch something, see something, hear something, such as my dog barking right now. Uh, it comes into the brain and the spinal cord. It has to determine if it cares enough, if it meets a stimulus. Something has to happen. There's a motor side. So I move my hand, a hormone is released, my stomach contracts. That's all motor stuff. All of those other modalities are working on the motor side. I work on the sensory side. This is why we all work. This just allows me a very gentle way in. Okay. So the other difference is that my job is to get to the root cause of what's going on. So, for example, is the back pain really coming from the back? Is the shoulder pain really coming from the shoulder? What's really going on? Why are these symptoms presenting? Why is there pain where it is? Because it might not be coming from the area that's screaming the loudest at us. And so how I do that is I always will do a full body assessment, no matter what. And I only treat what I find that day. And so I really am looking at the body in a three-dimensional fashion. How everything connects, everything being all systems. And I really do work with all systems, from the skin and the fascia, muscles, ligaments, tendons. I do work with the bones and joints themselves. There can be visceral manipulation sometimes of the abdomen, cranial work, sometimes facial bones. It's really quite dependent on what's going on with the individual. And then I work with the nerves, arterial flow, venous and lymphatic drainage, which we refer to in osteopathy as navel. And that's another thing that makes us different. How we work with the nervous system, how we work with arterial flow, venous and lymphatic drainage. So next, we're just going to run through what a treatment process would look like if you were to come in and see me. Now, everybody's a little bit different, so I can only talk to how I run through things. Okay, so initially, the initial appointment is about 45 minutes, and that's so that we can take some time to figure out what's going on. Usually, people will come in for a variety of things: low back pain, headaches, digestive issues. Sometimes they come in specifically for things they're experiencing from menopause symptoms. So from there, we'll have a conversation, we'll get to know what's going on, and then we'll move on to the table where we'll do assessment and treatment with hands-on work. So through that, we're doing a full body assessment. We're seeing what's going on in what system on our way to locate where the true root of whatever is happening today is. We're addressing it, treating, going back through reassessment, and we work through until we bring the body back into better alignment overall. The goal is that our structures really are where they were intended to be, because where that is where our body is in its most position of ease. And when we are at ease, there is health to be found. And so through that, we're bringing the body overall, all systems, realigning them, balance, equilibrium, that sort of thing. Now, once you've sat up, this is really when the treatment starts. That's when you leave. That's when you go home, you go back to your life. That's when you're returning to whatever you were doing that day. That's really when the treatment begins. And that's the integration part of this. That's when your body has to take over and it has to respond to these changes. It has to realize it's in a new position. Even if it's a better position, it maybe hasn't been there in a while. And so it may feel a little bit different. It may feel a little bit weird in the sense of, oh, I'm sore. I wasn't sore before I came in. Now I feel a little sore now. I'm really tired, that sort of thing. So that's the integration time. Now, the treatment time itself, active treatment time, is about 20 to 30 minutes. It's really not a lot of time commitment. The time between treatments is very individual. My goal is to work with every person with where they're at and with their body that day. And so sometimes people need to come a little bit sooner, sometimes a little bit farther in between. It's going to really depend on how your body responds to osteopathy and how everything is feeling. So that is a variable state of what the body needs. Now, the
I just
cycle of,
wanted to ask you a
oh,
couple things.
yes,
Can you go back to that slide? So
absolutely.
let's just play like devil's advocate or whatever. So maybe I'm from a family where we just never talked about, like I was specifically told, don't tell Uncle John that you got your period kind of thing because we don't do that, right? We don't tell people. And then, so then that is your patient showing up and kind of looking at you like, how do I talk to a practitioner that I just have met, but I know that I need to talk about perimenopause or menopause issues? Um,
Absolutely.
how would you suggest that someone like that go about doing that? Like, what we did was have a little like meet and greet, and I'm very forthcoming, and you took it like a champ. So then I knew we were okay. You weren't going to freak out about it. But how would a woman deal with that if she's, not if she's never really talked to a man about this before?
Absolutely. I think that every person with any practitioner that you have, whatever the modality, even if it's your GP, being able to have the ability to be open and honest is dependent upon the individuals in the room. And so I think finding the right practitioner and the right osteopathic practitioner is really, really key. Oftentimes, a lot of us do offer an initial sort of no commitment, anything like that. Come and have a conversation or a phone call, sometimes a video call, just whatever's the easiest really is for myself. Whatever's easiest for you is easiest for me, and let's have a conversation. If you have a practitioner and your main priority is to address some of the symptoms of uh, of menopause, you'll know pretty fast if that's going to work for you or not. And I think that there's nothing wrong with trying out a lot. If it's not the right person for you, it doesn't necessarily mean that osteopathy isn't the right thing for you. It's just
Hmm.
finding that right practitioner that jives with what you need. And over time, also, the body tells us a story. We don't necessarily need you to tell us what your symptoms are. Oftentimes, the body will tell what's going on. So we don't always need to have that verbal conversation either, because, well, truthfully, my job isn't to treat symptoms. My job is to treat the person, the whole person, and through that, in bringing the body and the structures back into a better position overall, that's where we see relief of the symptoms.
Mm-hmm.
It's not that we're addressing the brain fog. It's that in how we work with the body results in improved clarity of mind.
Yeah, I've
If,
had less brain fog, by the way.
yeah,
I don't
great,
know that we've talked about that one, but I
great.
feel like sometimes women don't want to waste anybody's time. I had one where I did ask for a phone call and we had a conversation, and this particular osteopathic manual practitioner was, fine. Like I didn't get a bad feeling about it at all. But when I was trying to talk about specifically the perimenopause at that point, with the cycles being all over the place, and I really felt like he tuned out a little bit, and that was like,
Mm,
that's enough for me because I love to talk. And I think that why I'm saying that is like, don't feel bad if you meet with someone or talk to someone and you get a feeling like maybe that's not right. Just keep looking until you find someone who feels, because it is a manual therapy, right? Like I'm on a table and you're holding my foot or something,
yeah,
and I have to feel comfortable with you touching my leg or whatever,
yeah.
because I I feel like my job on the table is to relax as much as I can, which means I have to trust you.
Yeah. And it is a process too. It's really hard to let your limbs go to anybody. I have my own uh osteopathic therapist, and even I have a hard time here and there, depending on what's going on with my body, even though I have a trust with him. It Sometimes I can't let my legs go. And that's not, we don't control that oftentimes. That's because there's something going on in the nervous system, those sorts of things. But it does become easier as your body, one, gets used to it. You
Mhm.
feel more comfortable. But two, when the body's in a better place, it tends to have that more ease to it, that it goes, oh yeah, this is what I need. This is what I want. I'll just let you take it from here. And
Mhm.
sometimes it does take a couple of treatments when it's not something you've experienced before.
Yeah,
Absolutely.
and just keep it simple. Make sure that you're comfortable with the person, and then even if something happens where you end up, I had one I loved. I thought he was great, but then at a certain point, he told me I had scoliosis, and I've never heard that before. And I've seen, like, you name it, I've tried. I've had my spine x-rayed, and I do not have scoliosis. And there was
Mm,
just something about it that made me go, that's not for me. And went looking for someone else. And it's not that
mm,
the person particularly was bad or wrong or, terrible, anything, like whatever. He helped me many, many times, a lot. But it was that moment where I was just like, I'm done. And you can trust yourself. I think this particular kind of treatment actually does help you to trust yourself and taking care of yourself even
mhm.
more. So to everybody, don't be afraid to meet as many different practitioners as you want until you find someone that you feel like you'd be comfortable and that you could work with for a little while. And now I'll let you get back to it. That
Yeah,
was
yeah, absolutely. Okay, so now we're going to talk about the cycle of health. So the body has this natural inclination to be imbalanced, aligned, a state of homeostasis. It's a natural inclination. Now, through a variety of ways, uh, repetitive postures at work, illness, surgeries, hormonal changes, injuries, more time under gravity, more birthdays, those sorts of things, our body will get misaligned. We develop these twists, these turns. It's very normal. It's doing what it's supposed to do. And this is where osteopathic support will come in. So this is where my role is to support returning the structures back into their intended positions. And that's all structures, right? Again, I work with all systems. So that's any structure. And when they're in the best position, they have better function. So now we are restoring functionality. So Really, that's where the osteopathic support comes in. And this is something that will continue through life. You'll come and see me, you'll go into that integration phase once we get there. Because I think that truthfully, now is a good place to mention that my goal is so that I don't have to see you for why you're coming in. My goal is so that there is long-term sustainable change and that we bring your body back to its ability to do this on its own, which is this natural healing loop. And that's the beautiful thing about this is that we're working together for you and that your body can take over. We have this natural ability. It's really wonderful to self-heal and self-regulate. And oftentimes when people hear that, they go, what does that even mean? And so the best way that I can think about it is, we've all cut ourselves, okay? We slap a band-aid on that and we go about our day. We aren't thinking heal, 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 heal. We don't have to think about it. We take the band-aid off at the end of the day, we look at our hand, oh, this looks pretty good. It should be healing. If it's not, that's telling us something's going on, right? That's if we're not seeing that healing, then we go, oh, this is sort of strange. I should probably get this looked at, right? And so that is something that should, is happening. It's happening everywhere within us at all times. And so the goal really is that we come back to a better place of alignment for you in that day. You go away, you're integrating. Maybe a little misalignment happens, a little twist, but you don't come and see me right away. Your body just adjusts. Yeah, it feel really good. And we could pass some more time. And then something maybe else comes up and it's time for a little bit of support. We go through that again. And eventually, people don't need to see me at all sometimes. Sometimes it just comes to maintenance. And that's different for everybody. Oftentimes, people find that because of how we work with the nervous system, they feel good. And so they move to eventually sort of a once a quarter change of the season sort of thing. I like to say once the season changes is a good time to sort of get your body back in tune with this change of the season. So this is ultimately the goal. And this is where we see the beauty of osteopathy. And so I think that this is a really good time to talk about this. If there is any major thing that you take away from this presentation is I would love if it was this phrase here. The body is eternally optimistic. I truly believe that to be true. I think that, you know, for everybody, it's very easy to go into a state of, is this ever going to change? Right. So I have patients and they have joint pain out of nowhere. Woke up one day, their whole body hurts. I can't focus at work. I'm so much more stressed than I've ever been, but my work volume hasn't changed. It's making me feel anxious. I've never had any of this before. My digestion is all over the place, all of these things. And then we start to go, is it going to be like this forever? And the answer is no. It doesn't have to be. Just like we were talking about with that natural healing cycle, that is what it is. The body is naturally optimistic and internally optimistic. It will heal and things can get better. And though menopause is a natural, expected period of life, it can be experienced with more ease than I think previously we had thought it to because it was being ignored. And it was being looked at as, oh, you just have to go through that. But with everything in life, from injury to menopause to surgery, everything in the body is built in a way where it can keep going. And so it's really important to have that hope and that trust, really that trust that your body will lean towards health. My job as an osteo, really, the founder said in early texts, anybody can find dis-ease. It's our job as osteos to find health. And so that's our job, to encourage health in the body and to find health in the body. And it really is true. I see it every day in my clinic. So I just want to go over the hormonal changes because I think it's really important to discuss this because this is one of the biggest contributors of what's really going on is these changes in these major hormones, progesterone and estrogens, but we'll just say estrogen for now. Okay, so progesterone, its primary functions are in the reproductive realm. So it's working really to build up an endometrial lining, preparing for a potential embryo to implant, and prior to menopause, when it drops off, it promotes the sloughing of the endometrial lining, and then menses will happen. Now, in perimenopause, we see a steep decline, and that steep decline is largely contributing to the cessation of the menstrual cycle. Okay. Now, estrogen, it does play a role in reproductive health, absolutely, in regulating the cycle. It goes up and down throughout the cycle depending on what's going on. It also has many, many general health functions. So, the first one we see come into play would be triggering puberty. So that's when the secondary sex characteristics kick on, and there's a delineation in what a man looks like and a woman looks like, where facial hair versus breast growth, those sorts of things. So that's one of the major times it starts to kick on. It's regulating the menstrual cycle, ovulation, those sorts of things. It's also playing a role in so much more. There are estrogen receptors almost everywhere for women, and including the bones. So we start to see in let's go here. We start to see in menopause, all of these functions now will be impacted. Okay, so the receptors on bones, now we see an increased likelihood of osteoporosis. It contributes to muscle mass and the ability to build muscle mass. So now we see changes in the muscles. I'm doing the same workout I did before. I'm increasing my weights, but I can't build any more muscle mass. That's because there's a decrease in estrogen flowing around, circulation and blood flow. There are estrogen receptors within the blood vessels themselves that are contributing to the compliance or the elasticity of the blood vessels. And so cardiovascular becomes into play. And so all of these things that it's regulating prior to menopause now are impacted because they're not getting the amount that they had been getting prior to. So common symptoms that I'm seeing in my clinic, brain fog and lack of focus. And usually it's coming out of nowhere and it's really impacting the ability to remember things, to concentrate, to follow through in daily tasks at home or at work. And so then we start to see an increase in anxiety levels about that as well. I'm seeing a lot of depleted energy levels and sleep disturbances. People who never had issues sleeping before, all of a sudden they can't fall asleep, can't stay asleep, are waking up very unrested, joint pain everywhere for no reason, muscle tightness. It seems that my patients are telling me that they just wake up one day and everything hurts. Changes in digestion. All of a sudden, people who were not having issues with digestion are having constipation or diarrhea or both back and forth, or indigestion and heartburn, or changes in appetite even. Uh, that's quite common. Changes in skin, hair, nails, an increased urgency or frequency of urination, changes in balance and proprioception. I often have my patients telling me that previously or recently or more often, they're getting bouts of vertigo. There's no history of anything in the ears. They've got checked. There's nothing going on that should indicate vertigo, no history of whiplash or head trauma or anything like that, but they're losing their balance. Nerve type pain. all of a sudden the sides of my legs are hurting is what they're saying. And or random zings into their fingers, so those sorts of things. Changes in hearing, tinnitus or ringing in the ears or itchy ears all of a sudden for no reason, hot flashes. I think this one is really important to talk about. Now, it was sort of the poster symptom, I think, for a really long time. And I don't want it to be ignored because it can be really tied into the cardiovascular system. So there are so many more symptoms and that are coming out, and also even more symptoms that I'm learning about from my patients every week, but these are the most common ones that I see in my practice. Now, I think it's really, really important that though osteopathic care can help support with these, if you're having these or any other symptoms, make sure you're in touch with your primary caregiver about it. Make sure you're getting all of these checked out and that all of the systems that are in play here are doing everything that they should and that they're working tip-top shape. It's always good to make sure that you're in touch with that primary healthcare provider.
Yeah, I just want to hop in there for a second because I'm
Yes.
really, when I had the changes in balance and proprioception, like I would have dizzy, and that has gotten a lot better as well. But at first, I was really quite frightened of what was potentially going on, and did go. I had a good relationship with my doctor, and I've got a new doctor now that I think is going to be great too. But I really want to emphasize, so, okay, so nerve type pain, it could be related to perimenopause. And, that is something that could potentially happen. But there's also a bunch of stuff that could be really dangerous. So you never want to assume that it is. And you also never want to accept unacceptable wait times because there are ways to be seen sooner, which might involve driving or begging people to take you to different clinics or whatever it is that you have to do. But the changes in hearing and the tinnitus, like these ones are the weird ones that like itchy ears that get kind of forgotten about. So I'm really grateful that you've included that and encouraging women. It is really hard to go in and talk about something like that, nerve pain, especially if you have tried before and been dismissed.
Yes.
But it's always worth going back or finding someone else or asking to speak to a specialist and be the one making the noise so that you don't end up you know, in much worse condition because would you say if you saw me right away for any of these symptoms, it's going to be a little bit easier to help me if I haven't been sick with it for 5 or 6 years before I come in, right?
Yeah, absolutely. And that's I think one of the things why oftentimes care was being ignored, because all of these individually or put together are groups of symptoms of many other things. And so that's why if these symptoms are coming on out of nowhere, even even if you're in the right age or stage for it to be perimenopause symptoms, it's time to talk to your doctor or your healthcare provider, whoever that may be, and make sure everything is doing what it should. Because even if it is symptoms of menopause and you're entering perimenopause, there are things that you can do for them for that too, right? So it's really important that you keep that on board, and then you find again, it's anything, right? It's not just finding the right osteopath, the practitioner. It's finding the right doctor. It's finding the right care team, the right pharmacist, the right um, nurse practitioner, whoever it is, a physiotherapist, whatever is in your care team. It's making sure that as you're going through every age and stage of life that you have the right person, and that might change through a course of time. And so these symptoms are normal and also something to talk to somebody about. Yeah, absolutely. So we're going to talk first about the autonomic nervous system, and then I'm going to talk about fluid dynamics. And these are the two most impactful ways that I see how osteopathy is helping uh, women with menopause symptoms. Now, the autonomic nervous system comes into play for general health as well. And so this is the system where we have two sides of it. So we have the sympathetic side and the parasympathetic side. So autonomic is just that. It's the part of our body we don't think about. It just kicks in. And it was really built into our body as a survival mechanism. It was built in when we used to have to run away from tigers. And so that's what happens in our body. And it's the best example because everybody can imagine, or a grizzly, we're in Canada, something like that. And so what happens is anything now can trigger our sympathetic nervous system, a variety of things. We're living in a different cultural time. And so what happens is we are being chased by a tiger, or somebody runs a red light in front of us. That side of our nervous system kicks in and it does what it's supposed to do. It now shunts all of the blood away from my digestive system toward my muscles, my arms and my legs, so that I can run away from the tiger. It turns off my drive to have food because you don't want to be pulling over for a Big Mac when you're running from a tiger. It makes it so you don't have to go to the bathroom. It makes it so that you have enough light coming into your eyes so that you can see where you're going. And it's doing all of these things knowing that there should be an end to the time that I'm running from the tiger. I should be able to get away, and then I should be able to move into parasympathetic, which is rest, digest, repair. And that's just what you do. You flop down, your body now starts to starts to digest again, to take nutrients, repackage them, make sugars for storage again for the next time. It starts to heal all the muscles from running, all those things. And that's how the system was built in. It was really a survival system, but it's still with us. And our body has not developed the ability yet to dissociate between a tiger and a red light or my phone or anything like that. And there are other natural things in our bodies that actually initiate the sympathetic response. Pain. Pain is a really big one. And so I've hurt my back and now I'm in sympathetic and I need to be in parasympathetic to heal. And so we can see chronic states of sympathetic. And where that comes into play um, is that we're unable to balance the dimmer switch. Because I think that oftentimes people hear autonomic nervous system, fight or flight, freeze, rest, digest, repair. Some people have heard that. It's not an on off. So it should be a dimmer. Our body will go through states of sympathetic and regulate. And we have this ability to up down. But what's happening is more and more people are spending time in that sympathetic state. So we think about the menopause symptoms now that we just went over. There's pain involved in that. There's stress involved in that. Now we're swinging more towards a side of the sympathetic state, and we're spending less time in that parasympathetic state. And so really we start to see that playing a bigger role because it's impacting the blood vessels. It's impacting where the blood is being directed to more. And we're seeing that as we bring body back into a better state of balance through osteopathic therapy, we see a better balance in the autonomic nervous system. Now, there are many structural reasons for that. Uh, One being that our sympathetic chain ganglia, which are this is just a group of nerves bundled together, and they hang out in front of our ribs. And so they're impacted by rib movement. And if I have a twist through my body and my ribs aren't moving so well, then I can further see that go back into sympathetic state. So again, now we can work through the structures and see that everything has a place where it should be. So the other thing is that overall, when you are feeling less stress, you just feel better, right? You just feel better overall. And so you're in a better state to heal, handle pain coming your way, those sorts of things. Now, I'm going to jump forward to the fluid dynamics part because everything in the body is very, very connected. We hear that often, but it truly, truly is. The nerves innervate the vessels, the arteries, but those nerves have to be fed by the arteries too. And so we can't ever separate any part from the whole. And that is what the osteopathic approach is. We're really looking at the whole thing. Okay, so fluid dynamics is a really another impactful way that we're working with improving symptoms. So the human body is about 65 to 75% fluid. That can be arterial blood, venous, lymphatic fluids, cerebral spinous fluids, all the extracellular fluids or matrix that float around all of our cells, those sorts of things. Fluid's non-compressible. It's in us. Once it's there, if we twist and turn, it should move with us. It'll go other ways, right? We're not in a system where if I bend my elbow and now I have no blood flow, right? Everything is always moving, right? And so it's built in that manner. Now, hormones, estrogens, they hitch a ride through the bloodstream. And so they need a clear path. All of the receptors are everywhere. Okay, so we'll put it in this way. Estrogen is naturally decreasing. It's expected. We expect it to decrease, but the receptors don't disappear. They still remain. They are just becoming less active because they are being the little estrogen isn't going into them as often. And so we now are working with a situation where there are just naturally lower levels of an expected hormone that those receptors are thinking, hey, you should be here by now, but you're not here by now. And that's where we start to see these symptoms come into play because they're not being triggered as often. And really what osteopathy is doing is we're working with that decreased level. So we're making sure that the blood flow is as optimal as possible so that though there is less in the bloodstream, it is getting to its receptors as efficiently as possible. And so now we're seeing it still doing what it should do, even though maybe not as many receptors are being targeted, but the ones that are being impacted. It's more impactful. And so as we get the nervous system regulated, blood flow is regulated. When structures are where they should be, all of the pumps are moving as they should. All of that fluid is going where it should. And so we see relief and we see just a overall better sense of well-being, feeling better overall, and that's part and parcel to the blood flow and the drainage being more efficient. Um, and that's really what makes osteopathic approach much different. Is how we're able to interface with the nervous system and the fluids of the body in a very different manner. And we're seeing not only myself, colleagues are seeing really, really amazing changes in their patients who are going through menopause as well. So I just would love to go over a case study. I had a new patient. She was in her mid 40s, generally healthy. Through the intake, I learned some symptoms of perimenopause, but that wasn't why she came in initially. So it was just there in my mind to keep track of. She actually came in because she slipped while she was running, and she didn't really know how she fell, but she had shoulder pain. So she said, my shoulder's hurting. I got to address this. And then through the conversation, she'd also told me that, you know, I hurt my shoulder. Shoulder pain started 2 weeks ago, but I came in now, and I've also got back pain, and I have headaches, and it doesn't feel good to exercise, so I'm not really doing it much right now. All those sorts of things. And then through the process of, again, conversation, because it's really important that these conversations are always happening. Those symptoms that she had already told me about, she said, "Oh, actually, you know what? This has all gotten worse. I have this injury. My brain fog is worse. My balance issues are more prevalent, worse sleep than before, and it was already really bad. And my energy is crappy." And so this can be expected to happen, not always, but it's not a surprising thing when this happens. And it's because of what we just talked about, because injury, pain, twists and turns are impacting the nervous system and impacting the blood flow. And so we're more in a state of sympathetic flow. So now that twist that's already changed the blood flow is being impacted by the nervous system. And so now those estrogens are not getting where they need to go as efficiently as they were before the injury. And now there's that injury, and now it's compounded it. And so what happens? This is where osteopathic support can come into play. I went about treating her whole body as I would, restoring balance to all of the big structures, making sure that everything was moving appropriately, restoring all the big pumps to make sure that blood flow was going back. And over the course of treatment, well, shoulder and back pain was gone, back to exercising, no more headaches, improved sleep, and better concentration. But what caught me on this one was that she said, actually, I'm having better sleep than before the injury. I have less brain fog than before the injury. And I no concentration issues at all. And so that was where it was, we weren't even back to the point of the perimenopause symptoms before the injury. We had improved even from there. And so that is such a positive thing to see, because the quality of life uh, is restored in such a really amazing manner that, this patient, I don't really see that often anymore, right? I really don't. I see them once in a while, and usually it's just for a tune up, and they're feeling really good. And it got me thinking, right? Like I understand the human body. I understand how all of this works. Then you start seeing it time and time and time again, and you see it in practice. And it's really going to show how amazing the body is at finding health. Once it has that little nudge, that ball gets rolling, and it's like a snowball. It gets bigger and bigger and bigger, and it just wants to keep on going. And I'm very privileged to be able to provide a treatment that can give women relief from these symptoms, and also give them the ability to feel better overall. And so here we were, quality of life, happy days. And so this is, I think, another big thing. Movement is medicine. And so I'll start from the inside out, because we're working to restore movement and motion everywhere in the body, every structure in the body. And when they're moving appropriately, whether it's your hip bone or your estrogens or your blood cells or your food moving through the system, the nerves, whatever it is, if they are moving as intended, they're functioning better. And when they're functioning better, we feel better. And when we feel better, we're more likely to take ourselves outside and move ourselves actively. It really comes from the inside out. And then we're moving more. And we all know, exercise, doing those things, that's medicine. And it truly is. And it's really hard when our body is in a position that it just is not optimal. It doesn't want, I don't want to go exercise if my back hurts, right? It doesn't feel great. And so as we restore all of these structures, it's promoting that and it's helping, get outside, go for a hike, just do something that you like. And a lot of that times is I see it come from just getting the structures back into place. Then there's that motivation again to do those things, and to keep on moving. So if anything, any takeaways from today is that the body is eternally optimistic. Movement really is medicine. And as a manual osteopathic practitioner, my job is to restore motion to every structure within. And that helps promote us to then take care of it on our own. And so this is my contact information here. I am at multiple clinics, which I put at the front there. And so usually the best place to find the best place for you, I'm in 3 different quadrants of the city. So the main page is the best, and whatever easiest place to find me, get in touch. Please send your questions. And if there's any questions today, I'd be happy to do my best to answer.
Oh yeah, Mac, that was really great. I I really appreciate the whole explanation about the nervous system. I don't really have a question, but and no one has chatted in anything about the question. So but I did want to say I really feel like the whole I think back pain was really what why I came in to see you in the first place, the
Yep.
main complaint.
Yep.
And on that movement is medicine, which I'm so glad that you mentioned because I'm a yoga therapist and our psychologist, our counselor last night also mentioned movement as medicine for mental health. Um, but with the back pain, after I saw you, part of what I realized was that I was resting it too much because rest is great and it's good for, you do need that rest for the body to restore, to be able to heal properly. But I was really spending way too much time on my back, laying in bed and not moving. So none of I think really the blood flow just wasn't happening at that
Yep.
point in the back at all. So getting it moving again, um, really has made a huge, it's not completely gone, but now when I'm feeling it, I kind of check in, is this a stop moving kind of pain, or is this a let's just roll around on the floor and do some of the yoga that I do a lot of modified yoga. I don't do exercise yoga. I exercise for exercise. I yoga for yoga.
Yeah.
So that's really good to kind of like piece that together as to what's happening there. And I had so like I don't know if you saw me like writing little notes about when you were saying something that might make a good little mini clip because I was making mini clips today with Jane's presentation yesterday, and I have so many of them in here. It's gonna be hard because I was like, okay, just 3, right? We'll give like um 3 little hits basically. Uh so we got a lot in there, and I love that the body is eternally optimistic. It is a healing machine, but from someone who was sick for quite a long time, it is hard to turn that around and believe that your body is able to heal if you haven't felt that you became completely well again. And
Yeah.
then there's been like a redefining of what wellness is. So every day I have a plan for what kind of movement I'm going to do. And then every day I check in if that's realistic and if I need to adjust. So I work with a personal trainer twice a week. That's my goal anyway. And I was canceling on her if I wasn't feeling like I had a good sleep. And then I realized that was working against me as well,
Mm.
that I needed to just say, okay, I haven't had a good sleep. Let's do an overall workout, or I like the rower, so let's spend some time on the rower, some things that are less stressful on the body, but still moving everything and still supervise so that there's an overall plan of how that's going to work out for us. And There's one other thing I wanted to say, and now I can't remember what it was because that's just my brain fog is better, but it's not completely gone. Oh yeah, this is what I was going to say. When you were talking about, of course, I did my yoga therapy program, so I had to do all the anatomy and physiology stuff. So I know about the nervous system and the different parts and how they kind of work. And I like the idea of the dimmer switch, right? Rather than it's an on or off, because you might be a
Yeah.
little bit stressed. And I feel like in perimenopause and menopause, we're just way too high on that one level.
Yeah.
And one of the things I noticed when I was with you the last time we did a treatment was I felt I was kind of going into that yoga nidra state of like where you're really in that rest and digest, like
Yeah.
you're almost asleep, kind of relaxed. And I really felt like that was really a good sign of how effective it was really getting for me because it'd been overall a stress case. Type A personality and a kind of a go-getter and busy and doing a bunch of stuff all the time. So to actually get myself to learn how to rest, I had to learn restorative yoga, yoga nidra, and yin yoga because
Mhm.
I needed a structure like to this is rest time. But
Yeah.
my body just kind of knew that that's where it wanted to go. And then I was able to experience that same sensation of deep rest on the table.
Yeah. And oftentimes you get into that sort of I feel like I'm asleep, I'm not asleep, or some people will do fully fall asleep on the table from time to time. And we get a lot of those nice digestive noises,
Yeah.
right? The grumbles, those sorts of things. And that's really what we're looking for too, because in order for our body to heal and maintain these changes, we want it to be ideally in a parasympathetic state or more in a parasympathetic state to adapt these changes as well as possible. And osteopathy really has an amazing way of doing that and being able to work with the nervous system and really promote that, which ultimately helps the integration phase moving forward. And that being said, we do live in a very stressful time.
Hmm.
And we live in a culture where stress is just a little bit higher. And so it's okay if the first couple of treatments you feel you're not getting into that state just yet. Sometimes we have to nudge the body towards that state so that it remembers it can do that and then it understands, right? And so sometimes
Yeah.
people will say, well, all of my friends, they've went and had osteo and they've said they fell asleep on the table, but I feel like I'm not going to I didn't fall asleep. Is this still going to be helpful? And yes, because we're still getting into that nervous system even if it doesn't feel quite like it yet. We are able to feel those changes in the tissues that can sometimes present first before those stomach rumbles, right? They can present first before that, wow, I'm really in a deep sense of relaxation right now. And that's really a big component part of it too. But it's all a process. Yeah.
Hmm. Yeah. Oh, yeah. And there's one other thing I was wondering about the work with the cranial sacral kind of neck and head
Yeah.
and that being effective for brain fog. Have you noticed that at all?
Well, I would say that the craniosacral is a branch of osteopathy, right? So it is a component part. Now, to pinpoint if that is the thing that addresses it, I'm unable to do so because
Hmm.
I will only work with those structures when it's required. And I see changes in that with people I haven't done any cranial work with. And so that's why I really firmly am more on the side of the changes in blood flow and the nervous system,
Yeah, the
as
blood flow.
yeah, as well as, and it comes back to the nervous system and to blood flow. if you imagine that, something is out of alignment for whatever reason, every structure has to respond. So truthfully, our body only has one goal, and that's to keep our eyes level on the horizon, which kind of goes back to when we were talking about running away from tigers. It was so that we wouldn't trip and fall. And
Yeah.
so you injure your back, it will pull, but we can't walk around like that, or we can't walk around like this. So it will compensate. It will
Yeah.
take care of it through any system in all ways. And so what happens is we have these altered positions, and our brain, which is our true center of command, well, the information that's coming up is different than it's expecting, right? And so
Mhm.
as we start to bring that back into better alignment, well, now it's free.
Yeah.
It can now feel those things. And oftentimes that's the blood flow, right? Nervous
Yeah.
system
Yeah.
blood flow. Now they're matching better and decreasing of brain fog. I can't pinpoint if it's one or the other, but I see it when I don't do any cranial specific work on those patients as well. So I would say it plays a role, absolutely
Mhm.
patient dependent,
Yeah.
uh, but it's not. I wouldn't say it's the thing.
Yeah.
Yeah,
Yeah.
it's just getting the body back
Well,
better overall.
I mean that's so great. I feel like I could ask you a million questions and talk to you all day, but we're up to an hour, so I think we covered a lot of information. I know I learned a lot, which is great because I love what you're doing, and just in general, I'm a big fan of the the gentle approach
Yeah.
and and how effective it is. And I do feel like after I see you, I realize that I really should come home and have a rest and kind of just let everything do what it's got to do to settle. And then I feel pretty good right after that, after I have a rest. But if I don't give myself a little bit of downtime afterwards, and I just try to go right back out into the world and, be on, it's not a good idea. So it's a very good for self-care, just in general,
Yeah.
experiencing osteopath. So
Yeah.
I'm going to put that there, and that'll be the end of our presentation for today. But I'm so glad that you gave people contact information and that they can be in touch either directly. And I think I have an appointment with you in 2 weeks, so I'll see you then.
Okay, great. Well, thank you so much, and thank you for bringing me on to chat today.
Yeah, yeah, it's been great. Thanks so much.
Okay, bye.
Bye.